Hi everyone, thank you for joining. My name is Mehanna, and today I'm lucky to have Dr. Phuenpathom and Dr. Bhidayasiri, who are the authors of the article Vibratory and Plantar Pressure Stimulation, Steps to Improve Freezing of Gait in Parkinson's Disease. So can you tell us about the impact of freezing of gait in Parkinson's disease?
Freezing of gait is a very common symptom in patients with advanced Parkinson's disease, and as we all know, is one of the major contributors of falling patient with Parkinson's, and also in some other form of Parkinsonism in which freezing of gait might be quite common. And in addition to fall, which is obvious problem in patients with Parkinson's disease, the freezing of gait can contribute to fear of falling and makes patients don't want to go out and enjoy their daily activity, as they have a tremendous fear when they go out and walk. So obviously it's impact patients' quality of life.
Can you tell us more on how this method improved freezing of gait in Parkinson's disease patients in your study?
So as Professor Roongroj said, this brings great inspiration to us. And then I attended the clinic and met many patients who suffered from FOG. So I get more interested in this condition and found that some of them was refractory to medication. So this brings me to the thought that non-pharmacological approach might help many patients with this condition. And previously, there were hypotheses that FOG in PD is from the dysfunction within the basal ganglia and its dysfunctional connections. However, emerging evidence suggests that peripheral control of FOG really exists. And numbers of evidence supports our hypothesis that combined stimulation results in enhanced proprioceptive processing or dual action stimulation, which you see that it consists of the feedback and the feed-forward loop between the central and the peripheral nervous system as seen in this slide. So let's see how is this loop explain our study. When plantar pressure stimulation stimulates the residual A-beta cutaneous mechanoreceptors here, and the vibratory stimulation at the Achilles tendon stimulates muscle spindles here. These two enhance the feedback signals, which ascend to the spinal cord here, the brainstem, the thalamus, and the sensory motor cortex, which contributes to the feed-forward mechanism. So you see that there is synergistic effect between the signals from different receptors and area of stimulation, which results in improvement of FOG and gait parameters. So this is the first one, and the second mechanism involves a cue-related effect. The basal ganglia provides internal cues that control the gait pattern. So in PD patients, there was dysfunction of internal cue and the impairment of the sequence effect, causing gait abnormalities. The improvement of sequence effect were demonstrated by the improvement of gait parameters and asymmetry as in our study. So our sensory stimulation can represent an external cue, which can be used to improve the sequence effect as in our study. So these are hypotheses which explain the combined stimulation in our study.
And so how soon do you see the positive effect on freezing of gait after this vibratory and plantar pressure stimulation?
For the effect, as you asked, according to our study, it occurred 5 minutes after the stimulation. So we would say that it is the immediate effect of combined stimulation. And this is like in this slide, you'll see that it occurs 5 minutes after the stimulation.
And so what are the limitations of your study?
There were some limitations of our study, including the small sample size. However, the size of our study cohort was comparable to those featured in previously published studies. And another limitation is that while leg trembling was observed in all subjects with FOG, details about leg movement during FOG episodes were not captured. Furthermore, we note that our stimulation protocol was not synchronized to the gait cycle and that our findings provided no insight into the long-term benefits of combined stimulation. And because our initial aim was to evaluate the immediate effect of combined stimulation, this can prevent any harm that might result from a continuous stimulation protocol.
Practically, how can this be used in daily life?
Good question. And I think that our findings really pave the way and provide some good evidence that the treatment for fixing of gait are not limited to the pharmacological intervention, in which we are aware that are partially. So one of the work that is being conducted is to embed this type of the stimulation, both the pressure and vibratory, in the shoes of Parkinson's disease patients. And we try to test this paradigm in the real life scenario. And I can share with you some of the early findings that is very encouraging. And we are very hoping that this type of novel Parkinson's disease cues can be implemented in the daily life of Parkinson's disease patients to improve their freezing of gait and ultimately reduce the fall of the patients and improve their quality of life.
Well, that's very promising. That would actually, that would be great, because we're so limited to, medication help to some degree, physical therapy, but then even then. So that is very promising. Thank you so much, Dr. Bhidayasiri and Dr. Phuenpathom, for sharing this information for us, for joining us to explain and share your findings.
Thank you.
Thank you.
Thanks for
very
having
much.
us.